Herpes zoster or shingle. It is a contagious disease which is produced by varicella zoster virus. This is the same virus that produces chickenpox in the early life of the human being. So the person who has suffered in his early childhood by chickenpox may suffer from this disease. So it is compulsory factor that the herpes zoster only appear in those person who had attack of smallpox in their early life. The virus is the same one. It is very agonizing and produce stabbing pain, excruciating pain, which is intolerable by the patient. The virus from the attack of chickenpox that passes through the sensory nerves beneath the skin into the dorsal ganglions of the spinal cord, brain, that is anterior and posterior horns of grey matter, and trigeminal nerves, dorsal or ventral ganglions. I mean in the neurons of the nervous system, central nervous system. Because the skin complications or the symptoms in the chickenpox was cleared off by the treatment in the patient in his early childhood or early life, but the some of the viruses which are living one that passes beneath the skin in the sensory nerves, and they are become dormant that is inactive in the ganglions. When the immune system of the person suffered from chickenpox is weakened almost after the 50-year age, or due to the other chronic diseases like chronic disease of the lungs, diabetes, hypertension, hepatitis, HIV. These are the risk factors which weakens the immune system of the patient. So when the immune system is weakened, these viruses which are present in dormant condition in the neurons, they replicate. They divide and increase in the number, and then they again retrograde passage through the sensory nerves into the tissue beneath the skin and produces the symptoms of the herpes zoster, that is blisters in the form of crops which are very itchy, very painful, and they produces local paresthesia, that is tingling and numbness, burning pain in that dermatome. So this is a recurrence of the chickenpox or the flaring up of the chickenpox in second phase. But there is difference in between the two ailment. In herpes zoster, the rash which is red consisting of macules, papules, vesicles, and then passes into the which are filled with water, and then that burst and leak out the water and produces ulcers. They are always unilateral, doesn't cross the midline, and they are in the form of belt in one or multiple dermatomes. This is the difference between the eruption of the chickenpox and the herpes zoster. So this is a disease of the agents, but those person who has had attack of chickenpox in their early life, but the virus the causative pathogen is the same one. Even the eruptions or blister formation, they resembles in their morphology. These consist of three phases: pre-hepatic, hepatic phase, and the post-hepatic zoster. There are three stages of the disease.